On behalf of Loma Linda University Health Surgery Residency Program, I want to welcome you and thank you for your interest in our program. I'm Jukes Nam. I'm the program director for the residency program. We are an academic medical institution. We've been training surgery residents for over 50 years. So we've been doing this for a while, and many of the surgeons in the Inland Empire here in Southern California have been trained or have ties through Loma Linda.
I think one of the best ways to describe our culture is that we have a very supportive but also very growth-oriented mindset here at the program. Our attendings, our senior residents, our chief residents, everyone is really invested in making sure that we feel very competent, but also everyone helps us navigate how to fill the role and identity of being a surgeon, both in and outside the operating room.
When I was looking for a program to train at, I wanted to be sure that the place that I was going to had multiple locations. Loma Linda is nice in the sense that there are 5 different hospitals, all within 5 minutes of each other, all on the same street. This makes home call reasonable, and it does diversify our training so that it well equips us for the future. Another point that I was looking for in a training program is the rigor that comes with a level 1 trauma center and an academic center. Here at Loma Linda, our reach is so broad that we serve a population that spans all the way to Las Vegas and all the way to Arizona.
In the Department of Surgery, we have the Division of Acute Care Surgery, the Division of General and Gastrointestinal Surgery, Surgical Oncology, Transplant, Peds, and Vascular. We have the General Surgery Residency, the Integrated Vascular Residency, and fellowships in almost every other division, including surgical critical care and trauma, vascular surgery, surgical oncology, complex general surgical oncology, pediatric surgery, minimally invasive surgery, and transplant surgery. We also have a very unique global surgery fellowship, and coming soon we'll have a colon and rectal surgery fellowship.
On acute care surgery, we do try to avoid 24-hour calls for our residents and our faculty due to the intensity of the work, and we do expect to be able to provide excellent care, and for that reason we do support 12-hour shifts. Another unique feature of our residency program is the fact that we have one of the most well-equipped gyms in the city of Loma Linda. This gym is walking distance from our main hospital. The gym has all features to include a tennis court, volleyball court, soccer field, pickleball, which is very popular here. Our residents have free membership, and so do faculty.
When I came here and rotated here as a medical student, I was already a medical student here at Loma Linda. I felt like I was a part of a family. And so when I marched here as a resident, the same vibe continued. I feel as though I'm supported in my learning, and that even if I make dumb mistakes, which I do and everybody will, I can learn from them and it's not held against me.
The faculty just really care about us. I found that over the years, I found more and more mentors, everyone who wants to see me grow and what's best for me, even if it's not their specialty. Our program leadership, especially coming from our chair and our program director, they get to know us on a personal level. They want to know about our families, know what we do outside of the hospital. When I was a junior resident, I could look up to my seniors, approach them with personal or professional issues. The entire culture is just expected to be supportive here.
My favorite experience so far in residency has probably been my intern year. I was cross-covering a trauma night rotation, and I was so scared. I felt very overwhelmed, and I felt like a lot of the burden to take care of the patients was on me, and I was worried to reach out to someone. And as soon as I was getting to my most amount of feeling overwhelmed, my senior resident texted me out of the blue and said, "Hey, how can I help you? How can I, how can we conquer this together?" And it was really reassuring because I didn't reach out to ask at all. They knew exactly how I was feeling, and I think it was nice because I felt very safe at this program.
One of the things that made me really excited to train at Loma Linda was their long support for global surgery. As a resident, I've already gotten to go to Papua New Guinea on a short-term trip. We also have a specific rotation built into our 4th year where we go to Malawi. So basically everyone goes unless you opt out, and that's a really good experience for people to kind of get a broader base of types of surgery that you might have to do in a low income or even like a rural area.
Our residents graduate with about 1,000 or more cases, which is about 20% more than is required by the ACGME. And not only the number of cases, but the complexity of the cases as well. We have a robust hepatobiliary, foregut, complex laparoscopy, and robotic cases. We probably have one of the highest volumes of robotic surgeries on the West Coast, and we're continuing to innovate and incorporate that into our surgery training.
In our junior years, intern and second year, there's a robotics dry lab that we go learn kind of how to dock the robot using the actual robot and a kind of simulator within one of the ORs at the surgical hospital. And during that time, you kind of go over how to access the online curriculum as well as all the necessary simulations that you need to go through to get your robotic certification by the time you graduate. And then as you become more senior in your residency, you get to do more of the cases, sit at the console, and then eventually you're kind of the one who's doing surgery from start to finish.
I want to talk about our wellness initiatives, and so I think the 3 core things that we have here at Loma Linda. First is the culture. Overall, this is led by our attendings and our chief residents, and we definitely make time to see each other outside of work and really build that camaraderie and build deeper relationships. We do this by having our family groups. These family groups consist of an attending physician and 1 resident per PGY class. And so this really integrates all the classes together.
For Loma Linda, I think what made it unique is that it did feel truly well balanced. At Loma Linda, you have the opportunity to do rotations internationally in developing countries, and so you get to experience what it's like to work in a lower resourced area, and those cases do count towards your case log. Additionally, there's an abundance of research opportunities. I actually have been able to work with a couple of great mentors, and in the fall I'm presenting in 2 conferences, which has definitely exceeded my expectations for what I'd be able to do in a busy intern year.
I knew I wanted to do research before I matched into general surgery residency. I wasn't sure where I wanted to do my research, but I was given the opportunity to do a PhD. And so Loma Linda allowed me to take an extra year off, gave me a lot of flexibility in where I could go in and outside the country, and I really appreciated that.
I hope you were able to learn more about our program. If you're interested in doing a sub-internship here, just reach out to one of our program staff members. You can also check us out on our Instagram or on the website, or even just reach out again to our surgery office to potentially even set up a visit so that we can meet you and talk to you more and see if this is a good fit for you for your surgical training.